Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the ASLD. I'm Marina Serper, Associate Professor of Medicine at the University of Pennsylvania, and I'm a special editor of an issue for CLD called Improving Functional Status in Patients with Cirrhosis. I'm here with Dr. Athidi Earasi, who is a second-year GI fellow at Duke University. And she's the author of the article, Getting Your Transplant Center Ready for Prime Time, Healthcare System Obstacles to Prehabilitation, which is published in this special issue. Dr. Earasi, thank you for joining us.
Thanks for having me.
I have a couple questions for you about your paper. Can you please first tell us about your paper and what prehabilitation means to patients listed for liver transplantation?
Sure. So, prehabilitation to a patient means a focused training program prior to undergoing a major surgery like liver transplant surgery with the goal to improve physical functionality and really the ultimate other goals of preserving physical function, muscle mass, and muscle memory after transplant. The ultimate hope with prehabilitation for a patient would be to have improved post transplant outcomes and ultimately have an improved quality of life. And our paper specifically focuses on defining a vision for the implementation of a prehabilitation program at a transplant center. We draw insights from prior successful prehabilitation models to clearly outline the recipe or key components that are essential to build a prehabilitation program. We also touch on the various healthcare system and administrative obstacles that are important to consider and propose a roadmap for creating a lobbying agenda for the establishment of a prehabilitation program at a transplant center.
That's wonderful. And in your opinion, what are the key ingredients for a successful vision of a prehabilitation program within a transplant center?
Key considerations for successful prehabilitation definitely involves a multimodal approach, integrating physical exercise, nutritional, and psychosocial interventions is key, and this is actually summarized in Figure 2 of our paper. And although implementing prehabilitation programming for all solid organ transplant patients is ideal, initially when you're implementing, taking a special consideration for populations, especially at higher risk for unfavorable surgical outcomes, is ideal. So this includes patients who are elderly, malnourished, or obese, or those with significant psychological comorbidities. And then implementation would ideally be for a longer duration prior to liver transplant surgery. About 8 to 12 weeks is ideal and can lead to better outcomes. And I think the most important key recipe or ingredient piece in terms of implementation would be to offer patients flexibility to choose the most convenient setting for their engagement, whether that's a prescribed exercise regimen in a community gym or home, or even exercises they can do while in the hospital. Allowing that flexibility ultimately is going to help promote engagement and commitment to the program.
Thank you. And are there clear benefits that we know about of prehabilitation for patients on the liver transplant wait list?
Yes, there are so many important benefits for prehabilitation for patients. There's a decent amount of literature on this, and prior research has shown that prehabilitation in liver transplant patients is associated with an improvement in frailty metrics, such as the liver frailty index. And an improvement in the liver frailty index is further associated with increased or improved post transplant survival. In addition, prehabilitation before liver transplant leads to enhanced aerobic capacity. It's safe and also yields short term benefits in terms of functional status. And one of the nice things about prehabilitation is that it facilitates the adoption of healthy lifestyle habits, which are ultimately vital for management of the known metabolic complications that can happen with long term immunosuppression. And again, kind of harping on the main goal of all of this is improved patient wellness and quality of life after transplantation.
Um, that's wonderful. Thank you so much for that. And my last question is, what does a transplant center, hospital, or larger national health system stand to benefit in prehabilitating patients for liver transplantation?
So the main benefit is that prehabilitating patients leads to healthier patients, and healthier patients have improved post-transplant outcomes, such as shorter duration of hospitalization and improved mobility and functionality after transplantation. Because prehabilitation helps with improving muscle mass, it can also help with complications of dysmetabolic syndrome that can be seen post transplant. I think time will tell as we're learning more about this and benefits, if there are additional benefits in terms of reducing immediate postoperative infection risk, reducing ICU stay, and improved mortality longer term. And I think lastly, although there is an investment upfront for implementation of prehabilitation, there is a post-intervention financial benefit for the transplant program and the hospital system, mainly due to the overall decreased healthcare utilization of patients who are just healthier post-transplant.
Wonderful. Thank you so much. That was extremely interesting, Dr. Earasi. Thank you for joining us for another installment in the Clinical Liver Disease video series. And thank you all for joining us. On behalf of all of us of the CLD team, I hope you found this video describing how to start and potential benefits of a prehabilitation program useful. For more information about our special issue called Improving Functional Status in Patients with Cirrhosis, please visit us at www.cldlearning.com. Thanks again for watching.